Good morning. It's a wonderful pleasure to be here today and see so many young people in particular in this podium discussion on Nature Heals. I absolutely love also the title, and it is so true indeed. But before we start the podium discussion and before I introduce myself and our brilliant, very diverse panel today, I would just like to point out that this is the 20th year of the Open Forum, and it's such a great format at the World Economic Forum because it's open for everyone, and it really stimulates a dialogue and discussion with young people, elder people, the entire society, as it should be. And if you want to mention anything on social media, you can use the hashtag WEF23 or the hashtag the hashtag OpenForum23. But without further ado, let me introduce myself first. I'm going to lead the podium discussion today. I'm very honored to do that. My name is Dr. Anna Erat. I'm a medical director in Switzerland in a hospital and hospital group called Hirslanden. But I'm not only a doctor and a physician by education and training. I have also a PhD in health systems and health systems management, and also tackle the health and well-being from a systems point of view. And in our panel, as I already mentioned, it's a very diverse panel where we look at health and nature and the interaction between nature, lifestyle, technology, health, and well-being from all levels of the health system. So let me first start with His Royal Highness, Prince Daniel of Sweden and Duke of Västergötland. Welcome. It's such a pleasure to have you here today.
Thank you.
And our second panelist is Erika Alessandri. She is a board member of Technogym and has a vast experience, of course, in exercise and health and well-being and the interaction between lifestyle and health. Welcome.
Thank you. Good morning.
And our third panelist today is Dr. Professor Jemilah Mahmood, who is also the executive director of the Sunway Center of Planetary Health. Welcome.
Thank you. Good morning.
And our fourth panelist, who is also a global shaper in the Los Angeles hub, Azure Skye. Welcome. It's such an honor to have you here today.
Thank you, likewise.
And our fifth panelist, all the way from Alaska, Harmony Weimer. Welcome. It's really an honor to have you here today. You are the vice chair of the Arctic Youth Network. Welcome.
Mariana, thank you.
So, as you know, we have a very close interaction between nature and our environment and nature has a huge impact on our health. In today's world, more than 50% of the world population lives in cities, and it is projected that in 2060, up to 80% of the world population will live in cities. I come from a country in the north called Finland. I grew up in the countryside. I was very, very fortunate to do that. In fact, I grew up in a environmentally friendly, ecological, experimental house that was mainly powered by solar energy. So I grew up with this, and it's really close to my heart to talk about nature and what we can do to cultivate a healthy environment and how that can profit our health. But most of us did not and are not growing up on the countryside. We grew up in cities. And cities have an impact on, for instance, how we can exercise, what we can do, how our lifestyles are, how we can cultivate a healthy living environment and exercise in particular. And as we know, for instance, cancers, 30 to 50% of cancers are preventable through lifestyle changes. And one of the major lifestyle changes that we can do, apart from diet and not drinking and not smoking, is exercise. Now that brings me to my first question. I mean, how can we cultivate a healthy lifestyle? How can we get ourselves to exercise? Because as you know, our brains have not really changed very much since thousands and thousands and thousands of years. We still have the same brain as we did when we were gatherers and hunters, but now most of us live in cities. What can we do in this new environment to make ourselves exercise even in an urban setting? His Royal Highness.
Yeah, that's a good question. I mean, as you just said, we have had the same brain for at least hundreds of thousands of years, and our brain tells us to eat everything that we come across, and then the brain tells us to rest, to be lazy. Lazy by nature is an expression, and I think that's we lived in an environment that we had poor calorie situation for many, many years. So it's very hard for us today. So I think we have to some extent, hack the evolution to feel good physically and mentally. And what you mentioned, exercise, sleep, being in the nature, the right type of food is helping us. So we shouldn't listen too much to our brains in that sense.
That's a great point. And maybe hack the brain at some stage. Exactly. Erika, I think we both stated and talked about this before, that exercise is medicine. What can you say about that? I mean, you are on the board of Technogym. You come from the industry that's really cultivating and supporting exercise. Also, your wellness foundation is trying to cultivate a healthy lifestyle and also surrounding to enable also exercise and well-being.
Yes, so Technogym is a leader in the manufacture of gym equipment and digital solutions for health, fitness, and sports performance. We've been talking in the last few days, obviously, of a very big pandemic that is not COVID, but our chronic diseases. Anna touched upon cancer. These are all lifestyle manageable illnesses, mental health, and exercise is really a powerful medicine to overcome these illnesses. So at Technogym, since it was founded almost 40 years ago, we've been trying to promote wellness and healthy lifestyles. Exercise is indeed a medicine. It is a very powerful tool. And what we've done is to create an ecosystem through technology, so connected equipment, content, applications, software. And this is a bit of a paradox because when we're talking about nature, we know that technology is one of the things that drove us away from nature, but actually there is also good technology that allows us to move more. If we really help people to change their behavior, if we help people move more, exercise more, they will be also more keen to, let's say, also spend more time in nature. And we know that this has tremendous positive effects on health. And in terms of our foundation, the Wellness Foundation, we started about 20 years ago the Wellness Valley, which is a social project where we engaged over 250 stakeholders from both the private and public sector to create the first wellness district in our region, where our headquarters are, Romagna in Italy. It's about over 1 million people population. And what we've done is we have engaged local administrators, hospitals, tourism operators, citizens, schools, to really promote wellness, create a culture, but also leverage it for sustainable economic development. In terms of nature, local administrators since 2020 have started rethinking the urbanizations of the cities to include more green spaces, to promote, for example, pedestrian paths or cycling paths. We have created the biggest open-air gym in the Mediterranean, but then also give the opportunity to people to, when it's not possible to be in touch with nature, to train indoors. So really foster a behavioral change and really get people educated around healthy living. Thank you.
Outdoor gyms, I love that. I was just in Tel Aviv a few months ago and saw how they were training on the beach, and the same goes for Venice Beach. That's absolutely, I think, it's amazing. And nature, as we know, nature does heal. And I want to come back to nature in a second, but if we first stick to the city, the next question would be to you. I think you call yourself an urban naturalist. I love that description. And there are studies that show that people living in cities are more prone to depression, to unwell mental health. And we've talked now a lot about physical health, but I would also like to tackle mental health. And what do you do as an urban naturalist in order to develop more healthy urban surroundings?
Sure. I think first when you look at urban environments, it's important to see them with an empathetic lens that grants you understanding to understand the circumstances that shape these spaces. Given urban spaces typically have a higher quality of life with access to healthcare and education and jobs, there also is exposure to other things that are not so pleasant. That's noise pollution, that's light pollution, that's just toxic pollution in the air. It's also loneliness and transportation stress. Also, typically people in cities have very active lifestyles. That includes a lot of obligations around their family and their careers. So these compounding issues create higher degrees of stress, which typically lead to things like depression and anxiety. I believe it's known, I think it's CDC mentioned that there's a 4 times rate of higher incidence of depression in cities. And so for us, we also see that fortunately, nature is a great tool in medicine, similar to exercise. With that, access to nature on a regular basis in your routine is prone to increasing your mental well-being and maintaining it over long terms of time. So in cities, creating green access is really important. And as an urban naturalist and also a former horticulturist, I do so with indoor plants. I've actually created a company called Erat, which is green in French, and we're the WAG of indoor plants. So we really incorporate indoor plant husbandry and care into people's homes to really imbibe greenery and to provide access to that no matter what setting you're in, if that's an apartment or even a full home in a city. And so for us, we really try to meet people where they are. If they have busy lifestyle, if they're traveling, we go to their homes and show them how to care for their plants so that they have access to that. We also see the biggest barrier in terms of maintaining indoor plants or greenery in your home is just the lifestyle and compatibility. Plants require constant care, and so creating solutions that are more adaptive to people's lifestyles and cities is the most important way to access that medicine on a regular basis. And we also have our own approach where we teach people to use plant husbandry or plant care as a way to imbibe mindfulness. So for example, if you were to prune a plant or repot a plant, you can do so by having a heightened intention of awareness about a plant's anatomy or life cycle, and that actually conjures the same connectedness you would feel in nature. So for us, it's really simple to seek these things, but just creating them in a way that makes it accessible and easy to maintain for people who have busy lifestyles in cities, and also affordable as well. And so overall, I mentioned earlier that mental health in cities is typically stimulated by just an excess degree of stimuli. So even beyond indoor plants and urban environments, you can really hack your space, similar to you, to customize your environment to have it more personable to your needs. That could possibly be getting an air filter or getting noise cancellation headphones, or even just earplugs, or perhaps light cancellation blinds. Whatever you have access to that you can create a barrier around stimuli that is unique to your environment will help you to create a chaos-free space where you're able to ground and to recollect yourself. So, yes.
That's really a myriad of various solutions, and also light protection, for instance, so that you can improve your quality of sleep and so forth.
Correct.
It reminds me a little bit of the urban farms you have in Brooklyn, in New York, on the rooftops,
Yes.
with some beehives, also having insects in the cities, and greenery and farms, and it's fantastic also for the quality of life.
It's common we use the word adaptation or mitigation commonly in environmental context, not in urban. That still is an environment and ecosystem, and so given that we're a part of that, we have to adapt our behaviors to create a more conscientious and healthy and harmonious environment for ourselves. So, yeah.
Brilliant. But Harmony, all of us do not live in urban surroundings. There are also people, I mean almost half of the world population living on the countryside or outside. And you coming from an indigenous culture, from Alaska, what can you say about nature and the impact of nature on your well-being? What's the impact also of climate change? Because you are really affected more perhaps than arguably than many people in cities to climate change. So what can you say about that and also about resource management? I really liked the quote you did the other day when we were talking about resource management. Can you tell me more about that?
Yeah, first I just want to introduce myself. Wina Kasugak, Kasatun Harmony Jade, Naknikamiamunga. So my Yupik name is Sugak, and my English name is Harmony Jade, and I belong to Naknik Native Village. Just wanting to bring a little bit of Indigenous context into this very Western space. But centric to an Indigenous worldview or to Indigenous well-being is connection to the land. And so I grew up interacting with the land, and that means in my region putting up fish. So well-being to me, I imagine a full smokehouse of sockeye salmon, and putting up that fish with my grandmother. So the intergenerational knowledge sharing that happens when we are able to access our own wild food. But again, I studied Indigenous well-being and food in graduate studies, so bringing that into more of a Western context and what does that mean. And the fundamental understanding is that in Indigenous context, it's not nature that needs to be managed, it's rather the humans that need to be managed. And so we bring that in with traditional stories and saying like how you can change your own behavior to reflect a better relationship with the land. And I think a quote that is great in representing this kind of reciprocal relationship is that with our salmon, we say, if you protect my future generations, I'll protect yours. So it's this kind of agreement that we have in that we're not going to overtake the natural resources because they're essential to our well-being as well. So I think that way of thinking can be integrated into maybe an urban setting or into non-Indigenous contexts as well. So just thinking of it as more of a one health rather than nature health, human health, environmental health, animal health, ocean health. It's all really intertwined.
They are in many ways inseparable, and I really also like the way how knowledge and the notion is passed on for generations, and that tying that to, of course, education, also more formal kind of education. Jemilah, what can you tell me? You're the executive director of the Sunway Center for Planetary Health.
Yeah.
So in terms of your role as the executive director and in terms of your work, how do you try to impact healthy lifestyle, nature for the next generation to come?
Thank you, Anna. I just love hearing what everyone said. And I want to start, Your Highness, to say that very inspired by a fellow Swede, Johan Rockström, who described the planetary boundaries, that we have finite resources and that we have to live in a safe planet, and there are things that we can't transgress. So please look at the Netflix documentary called Breaking Boundaries for this amazing piece of work that has been done by Johan Rockström, narrated by David Attenborough. So this is something that is a must-watch. Now, the title, Nature Heals, is wonderful, but nature actually prevents disease and illnesses. And so this is how important and valuable nature is. And what I do now in Planetary Health is really showing people that our health, the determinants of our health, 75% of it is social, environmental, and behavioral. And we live in the epoch called the Anthropocene, where we, human beings, are actually determining the outcomes of our future. It's our activities, our actions, our behaviors that are damaging the planet and then damaging our well-being and our health and the health of future generations. So what do we do then? So I set up this center about August 2021, so it's very new. It's in the university, but I call it a think and do tank. So we do the thinking, the researching, the teaching, but we also do. We influence policy, we put programs on the ground, we engage a lot with young people, because I truly believe the solutions are in the young people. We always say that we have to do this for the young people. No, we do it with the young people because they have a lot to teach us. And what we do is that we have built a course, a mandatory 7-week planetary health and community service, where we are piloting now. But from 2024, our university will be the first university in the world that every undergraduate must complete this 7-week course before graduation, which means that the future leaders on this world, whether they're going to be policymakers, they're going to be corporate leaders, they're going to be politicians, they will think twice when they sign on those dotted lines. They understand the impact of their decisions, that Anthropocene, on the future of this planet. So apart from that, how do we then incorporate nature? So we're doing things like, planet-saving meals, telling people that there are ways that you can consume without damaging the planet. And I absolutely love the salmon story, which I'm going to share with everyone now. But the other thing, of course, is that we build this teaching and training, and we're building this course called Conservation Science for Planetary Health, and it's a field course where anyone in the world can join us from Q3 this year, where we take you out into the nature, whether it's a dipterocarp forest, whether it's marine ecosystems, whether it's mountainous terrain, whether it is limestone karst, or whether it's an urban forest. And we'll show you what nature it has in store for us, but how that relates to health and economy as well. So we believe in learning by experience and learning by service. So it's building those value systems that is so important, as we face the multiple challenges we face today. So I think that, let me just end by saying that there's huge opportunities. I know that, for the young people in this room, there's a lot of climate anxiety. So we do something called Climate Courage workshops, where we engage young people virtually, and you're welcome to join us, where we have conversations with young people about how do they face climate change, and how do they build the courage to have hope and to cope with these changes as well. So I think nature is a real healer, and we have to protect it. And I come from Malaysia, where we still have officially 63% biodiversity cover, so it's a great place to experience nature without using a warm winter coat. And I think there's so much we can learn from each other.
Absolutely, and education is really key, whether it being really a formal education or passing it on from generation to generation, or just sharing experience. At all ages, you never stop learning. So children as well as adults, as well as more advanced professionals and adults and retired people. Which reminds me, I'm a part of a faculty at the University of St. Gallen, where we have we're just setting up a program called Next, where we really try to teach also more advanced executives how to create a healthy environment and how to foster healthy habits, which we're very, very excited about because it's one of the first in Europe, apart from the Oxford program. But I would like to go back to children, because that's where it all starts, actually. And your foundation that you have founded with your wife, Princess Victoria of Sweden, can you tell me more about what you do to teach children healthy habits and how you can foster them, and some solutions also?
Yeah, that's a big challenge, I must say. Every year we have an annual report like this. PEP, Generation PEP is the name of the organization. Small team, 12 people that work full-time with it. And we ask thousands of children and young people in Sweden how they live their lives concerning physical activities, how they eat, and it's quite scary. Only 2 out of 10 are moving as much as they should due to WHO's recommendation, 60 minutes per day, and only 1 out of 10 eat as much greens and fruits as they should. So we are doing a lot of things. We're trying to be a strong voice on this topic to inspire people to be more aware of the situation. And we have digital platforms for schools and kindergartens, and we're trying all the time to put focus on this matter. 2 days ago we had this big sports gala in Sweden, and every year we give a prize to someone, an organization or an individual that are doing great things for the younger generation concerning health. But still, it's hard. I mean, 2 out of 10. And we know that physical activities is a good protection against mental illness. We know that. It's a fact. It's a fact that we are getting less stressed if we are moving a lot in the forest or just being in the forest, or green areas, parks in cities works as well. So I find it quite frustrating that we know so much and we are doing so little to support the younger generation and their life choice. Was that?
Absolutely.
Did I answer the question? I don't know really.
You did answer the question. We just talked about the Danes before.
Yeah,
Did you want to mention that? Because that's
a couple of weeks ago in Denmark, the kids and the young generation, they have 45 minutes every day physical activity in schools, and now they have studied that, and 1 or 2 weeks ago it was launched, and it was an article in the Lancet, which is a great paper, and we could see that the kids in Denmark are moving 40 minutes, 20 seconds more now when it's mandatory. And that might sound quite, 40 minutes, is that anything? But that's a lot. I mean, as a grown-up, if you know that you are doing physical activity 40 minutes every day, we understand that does something with our bodies, doesn't it?
absolutely.
Yeah. So I think that's a typical example of how we can, from the state policies. Yeah.
Absolutely, and exercise doesn't necessarily mean that you always have to go to a gym, although I love going to the gym, but it doesn't necessarily mean that. And we saw that, for instance, during...
But Erika, I think it's a good idea.
I think it's a very good idea, but, but the everyday steps are also very important. We saw that during Corona, for instance, where people were in home office and suddenly they didn't take the bus to work, they didn't get there 10,000 steps or 15,000 steps a day. So a lot of those people didn't get the steps, and they gradually gained weight. We called that Corona fat. So now we need to get rid of that Corona fat. And one way to do that is just regular daily exercise. And that's also where urban planning and how we create cities and how we make cities livable really comes to play. And that's where I would like to look a little bit more into urban planning and also your line of work. What do you do to well, actually both of you, what do you do in terms of solutions to get people to move? We talked a little bit about the light and light protection and so forth, and the green spaces, which is so important. Has also a long tradition, actually. If you look at how New York was planned, or London, they have central parks that we knew hundreds of years ago already that we need these spaces. But today, what can we do to improve it even more?
I think many people in cities underestimate the degree of biodiversity that their cities actually have. We are aware of perhaps urban birds like pigeons, what have you, but there's a lot more to offer in every environment. I think with young people in particular, or people nowadays, there are many tools like iNaturalist, it's an app, as well as Park Pathfinder, that really engages people and encourages them to actually explore and discover their environments through engagement and community. So I think when it comes to urban spaces and planning, it's important to create spaces that conjure connectedness via discovery, so that you're even aware that you have nature in your city. For example, I'm from California, so we have access to trails and we have a really great national park system, but many places, for example, do not have that. And in fact, it may be dangerous to be outdoors and walking, there's crime. So when you have spaces that are dedicated, that are safe, it encourages that behavior, and it also makes it easier for people to take that behavior back home, and it conjures more connectedness in their spaces due to associating safety with nature. So for me, I think it's important to customize that care with the environment depending upon the factors. For example, me having access to nature is not the same as someone in Cleveland, perhaps, who doesn't have access to a park or even their seasonal capacity, like winter, makes that impossible. So things like VR are also a great tool to access nature in urban spaces. Doing immersive experiences that allow you to perhaps go to Iceland or go to an Arctic region where you cannot access that via travel. So there are many urban ways to kind of hack that, but also, of course, public spaces and planning are also a great tool as well. So,
Thank you. What about technology? We haven't really discussed technology very much. What can we do, or what are the dangers with social media and technology, and what are the opportunities? Because there are always two sides to one coin. I mean, let's first start with social media and all the gadgets that children have. It's much easier to put them in front of an iPad and leave them there to just watch a movie rather than interact with them. But what have you, for instance, Your Royal Highness, what have you noticed, or what are you doing in order to get children away a little bit from the iPad and
I have my own kids that I'm trying to foster in a good way in that sense. But I mean, we know that teenagers in the US, they use TikTok 2 hours every day. And if you have a long day in school and then you should do some homework maybe, and then you have 2 hours just on TikTok, you don't have so much time left to be physically active and be together with your friends. And I don't know, maybe we have been a little bit naive when it comes to the social media. I mean, we have the greatest minds creating a behavior. They know exactly what we are interested in and how they should keep us interested. Quite scary, I think. So I think we need some kind of shift in norms, maybe. When I grew up, some parents, smokers, they had their newborn babies in the car and they were smoking in the front seat. We didn't have a helmet when we skied. We didn't have a helmet when we cycled. So I think today we think it's quite stupid to smoke in a car with a small baby. I think in the future, I think we will look stupid if we have our mobile phone like this on the table at the restaurant, because we know that if this is on the table, you will feel that we have had a worse conversation, not as much quality in our conversation as it would have been if I have it in my pocket. So I think norm shift will happen in the future, hopefully soon.
I hope so.
Can I build on what was said by His Royal Highness? I think let's face that the horse has bolted from the cart, right? The social media is here to stay. Technology has entered the lives of the generations that are now on smartphones. One thing that really, what we're trying to do, right, in terms of how we're going to move planetary health ahead, is really looking at good governance, the education revolution that I mentioned earlier, and also looking at the importance of communications. Now, social media companies have already figured out the algorithms, and whether we like it or not, many of us are addicted to our phones. And it is a real addiction, just as it is alcohol or tobacco, but no one has held social media giants to account. Now, this is very difficult. I'm saying something probably very controversial here, because people all love social media, so do I. But I think that there is a conversation that needs to be held, and there needs to be shifts in some kind of regulations and policy. Now, irrespective, look at the from the recent, the height of the pandemic, the whole anti-vaccine movement, the misinformation, the disinformation, no one is held accountable. So this is, I hope WEF will one day focus on this as a very important problem that we need to deal with, whether it's for young people, or whether it's for businesses, whether it's for the health sector, whether it's for the environment. But we have that elephant in the room is how do we hold social media companies to account? Now, having said that, on the other hand, there are opportunities, right? I know in Singapore, for example, they've gamified health in the sense that you have an app, you can do things, you get bonus, you get vouchers, so it just gets people mobile. And the other thing that has been done in other settings is community participation. For example, hypertension is a very common problem in some communities. So if the whole community exercises and the mean blood pressure level is lowered, then there are incentives to the community in terms of, whether it's financial, fiscal incentives or so forth. So we need to be thinking differently from the usual way, we're using technology as well.
Did I sound very negative to social media?
No.
I think you were fair.
Yeah, I mean, I use it as well. But I mean, regulations. I mean, look at sugar.
Yeah.
In Sweden, Fanta, you say Fanta in English?
Yeah.
There is 18 sugar cubes in a Fanta in Sweden. In UK, where they have sugar tax, it's 7. I don't think that the people in UK feel sad about that. No. But why, if there is a solution, why shouldn't the provider of Fanta give us more sugar? Yeah. It's stupid. Yeah. Mm-hmm. They have to take some responsibility, I think.
Maybe they drink 2 Fantas in the UK.
Yeah. I don't think so.
If I may add, I said it in my introduction, and obviously there is bad technology, but also, as we said, good technology. Technology can be a key driver to advance behavioral change. So, for example, artificial intelligence, predictability can help people get, on the one hand, more personalized programs to live better and healthier, and on the other hand can create community engagement. People can, for example, feel that they belong to a specific community, and this is not only in terms of health, but also, for example, sports. So we're seeing that today more and more people are joining vertical communities, running, cycling, triathlon, even amateurs, just because instead of doing traditional fitness, it is still also a way for lifestyle management, for example. And so this can be a great driver. So we have, for example, augmented reality for entertainment. This can boost the motivation. So it's not all bad. There are also a lot of positives, and also technology can get the results faster. So it is not only a motivator, but also thanks to data and insights, you can get better quicker.
There's a great opportunity there, and there's always 2 sides to one coin, and we have to be realistic about that. Please.
Yeah, I'm wondering if we can have a nature intervention for this screen addiction, because at least for me, and a lot of people in my region back home, every summer we spend like 6 weeks at what we call fish camp. And for me, I commercially fish, so I'm out on a boat. I don't have access to phones, and so like I would be studying for 9 months, and then I would go back home and I just would have a complete detox. And it took quite a while to not have the urge to be like, oh, what are my friends doing? What's going on? But then after, I would be so refreshed. I feel like I would come back home to myself, come back home to my home, my culture, and just really interact with the people that I was with at the time.
Mm-hmm. But in fact, GPs nowadays, at least in New York, for instance, they prescribe nature time and outdoor time, and I think that's a great first step. Yeah. It's not the fishing camp yet. But
that's quite an intense example.
It's a really, really good.
You're right. In the UK, under the NHS, you can get sick leave to go walking for a week or something like that, you know, if you have mild hypertension. So, you know, doctors now also have to change. I'm a doctor myself. We weren't taught this in medical school, right? But the practice of medicine, the education of medicine now, this is why I'm passionate about planetary health, has to train medical professionals that sometimes it's not about drugs. It's about, you know, using lifestyle changes, behavioral changes, incentives to move and to exercise.
If I may add something also that Harmony said before, what is also very important is to put back humans at the center, and through education, if people respect themselves and you know, they have healthy and good habits, then everything that we've discussed about comes also naturally. So this is very important, to really nurture also humans and go back a bit to the roots, and then everything else, I think, comes with itself, because if you're self-conscious around certain topics, then you will be more keen to go to nature, to, you know, that you should eat in a certain way. So we truly believe that this is also a very important factor.
I couldn't agree more. In this open forum, we really want to also have an exchange with you. You're a part of the open forum. And so therefore, we really want to encourage you to ask questions and interact with us today as well. And you can even ask questions in German if you wish, because we have these headphones, and I think there will be a simultaneous translation in case there are German questions. But please, you have the opportunity to talk to this fantastic panel and interact directly. Are there any burning questions there? Yes.
Thank you very much. I'm Farah London. I'm actually from the United Kingdom. It's a question for His Royal Highness. In London, in particular in London, we have a very big knife crime pandemic happening. We're losing youth lives weekly to knife crime. Social media has played a big role in this, where they're being influenced from YouTube videos, creating that gang culture. What advice could you give from Sweden to the UK government on how they could actually direct youth in a better way?
Oh, what an easy question. I mean, we have so many big challenges in Sweden as well with exactly that. So I don't think I can't say that we are a role model in that sense. So unfortunately, I can't give you any advice. We have so much to do. But we know in Sweden we have like 10 million people lives in Sweden. We have more than 1 million prescribed with antidepressive medicine. And we know that physical activities have the same effect on mild, not if you are super mental sick, of course, but the mild anxiety. So, I mean, I think it's very important to foster a culture where the younger generation are physically active from an early age. If they do, they will feel much better and stay away from bad things in more at least. So,
And also
I couldn't help you, fortunately.
perhaps also create urban settings where people can go out and be in nature,
Absolutely.
even in the cities.
Absolutely.
Yeah, please.
So thank you to you all. It was really wonderful to listen to you and see there's so many approaches already for nature heals and going to nature and having a better health. So my question is, what do you see? Can we do that? It is more in the media, because I'm missing it terribly, that we have the good news and we see what is impacting, and we are having all the negative news on the side, but not enough good news. So what do you see? What kind of channels can we use, or what do you see that this valuable information and approaches come more into public, that people know about what they can do, and we have a wider spread of that.
Social media.
Shall I try to answer
Yes,
that? That's a really important question, and in fact, I'm speaking on that later today. I think one of the things we need to remind ourselves is that we are sitting in a very, very, unique setting right now. All of us are aware of these things, and we are in Switzerland. Many of you come from Europe. Communication and media consumption is very different in different settings. So understanding how people consume information is going to be critical. Now, without a doubt, social media has overtaken. In many of the countries in the West, TikTok is going to be the main source of information in the country. So how then, it comes back to how then do we engage with these social media giants? This is a project I'm on now, to say you have a responsibility to also provide information that's going to help people thrive. And the stories we tell about ourselves, the narratives that we use, I don't believe in the doom and gloom, because that doesn't change things. There are so many things we have achieved. Everybody, I'm sure, knows that our ozone layer has improved, right? We should celebrate this, because for many, many years, since Montreal, people have been alert, and companies, governments have taken steps to protect the ozone layer, and we have improved it. It's so much better now. But there are other things. So how do we tell the good stories? How do you create narratives and storytelling that is compelling, that is going to be motivating? Because at some stage, especially for you young people, when you have so many things coming at you on TikTok, you get so drowned, right, in information, and it's distracting. So what happens is you distract yourself further by looking at other TikTok videos, cat videos. I look at cat videos when I'm stressed. So I think, it's how we tell those stories, right?
Thank you for that.
Sometimes I think it's more interesting in spreading bad news. A grammar mistake, which I do plenty of, would be more interesting to spread than a knowledge or some good advice or something. So we have to look to ourselves as well. What are we talking about?
Sensational news just sells, unfortunately, but we have to change that, changing norms as well. Please.
So this question's for Harmony. You mentioned how we should change human behavior. So what can we as youth, but also older generations, do to move towards what you mentioned?
Yeah, thank you for the question. I think, in terms of climate change and changing our relationship with nature, again, coming back on the other question too, I think it's about having a narrative of hope. Because in my work with the Arctic Youth Network, I'm often at these Arctic fora, which is all the poles are melting, everything's horrible, and I'm just so I don't think that that's the way forward, and I think as youth we have a powerful voice to say, no, we can look for solutions for the symbiotic relationship, for how we love and care for nature as stewards rather than using it for our own purposes. Yeah. So I think it's about storytelling and even using social media to tell these stories as well as a useful tool.
If I may add to that also, as you were mentioning, really explaining the benefits to this is very important. What we see, for example, in the Wellness Valley is that the people themselves have become accountable because they saw the real benefit. And so you create a positive ecosystem that brings forward change by itself. So it's the people themselves that now, after 20 years, launch initiatives because they're really committed and they understand how important it is. But if you see also the tangible impact of it.
Very nicely put.
Could I add? I really liked the term you use, climate courage. I think there's always it's common to have a very disempowering narrative around climate, and that kind of framework is very enlightening. and definitely I think more motivating than it is discouraging. So
And empowering.
True.
somehow.
exactly, yeah.
Please.
What are your thoughts on using biomimicry techniques to work with biomaterials and create new ways of using plastics and infrastructure? And how would that change our relationship with nature if there was like biostructures all around you, instead of like concrete walls?
Shall I try? Yeah. So again, this is Planetary Health. A depressing fun fact is that we now have microplastics in our blood. And, it's partly, because of the food we eat, the plastic that lands up in the oceans and so on and so forth. But technology has advanced. This is why the stories of hope are so important. That nowadays, there are so many innovators creating packaging material, that is non-plastic and definitely biodegradable. So, I like that you're asking this question, because when I ask young people, all of them are concerned. So this is why I'm saying we need to make those policies with young people, because they are aware of the challenges they are going to face, and this is why they get depressed, right? This is why we do the courage workshops, because, how do you give them hope and give them the courage to, stand up and deal with the issues, but also help adults who are making policies do the right thing, right? So I think it will happen. I believe even in my lifetime, we will see the decline in the use of the conventional, plastics that come from hydrocarbons. And young people are advancing on this. If you go into this forum itself, you will see so many innovations happening. I'm pleased that even in the Congress, the paper cups are all biodegradable, because we always think paper cups are good. No, actually they have plastic lining, and you don't see plastic water bottles and so on and so forth. So well done. I think we are all moving in the right direction. We're seeing people carrying their water containers, being more conscious of the fact that microplastics are dangerous, right? And at the moment, there's a lot of research to see the health impact of that. It could be lung cancer, it could be, because the microplastics can lodge in all sorts of organs. Not to alarm you further, because we're not supposed to talk about doom and gloom here. But may I just answer the question that was directed to His Royal Highness about how do you deal with violence in intercity and so forth. So I'm a long-time humanitarian development worker, right? But one of the very interesting projects we did was around using sports as an agent for change. So I was working with the Red Cross for a number of years, and we did a project on taking young people, some of them in conflict countries, to play sports with each other. And while they play, they stop, and then they teach them about violence, about gender equality, about how do you deal with stress. So you'll be surprised that even urban street kids who were fighting each other with knives, then were slowly through sports develop good behaviors. So this is something that every country has a Red Cross or Red Crescent, right? So I think this is something that donors need to fund, because sports is a fantastic tool. Not only is it good for your health, but it's also a very good tool for peace building and community development. So I think the UK government used to do that, and they used to do it with Blackburn Football Club and a few others. So some of these referees really love this, because they feel that this is something they can do. Because being a referee in a game, you always have to stop the fights, right? So I think that they are well equipped to also, if we train them and give them the tools. There's a tool called Youth as Agents of Behavioral Change in the Red Cross movement that can be used to do all sorts of things, and we build in knowledge that we want to equip them with.
Yeah. In a way, the modern Olympics and the basic principles of the modern Olympics were based exactly on that. So we could go quite far, all the way to 1800 and, late 1800s, actually.
Could I add to the question about built surrounds? Additionally, with biomaterials, a lot of architects are beginning to integrate plants into their designs. There's a trend towards urban forest. where we're seeing selections being made to integrate plants into actual, for example, plant walls, or we mentioned earlier urban roofs. So there are many new ways that technology innovation are starting to value materials that are going to be, I guess, used, for example, for improving air, or just simply adding natural elements to improve well-being in spaces. So there are many ways to approach using new materials to create healthier environments and built surrounds. So, yeah.
Yes, please.
So my question is to Harmony. So you know the whole world is moving towards veganism, not just for climate reasons, but also for cruelty reasons. And you said one of your staple cultures and traditions is to go fishing, and you eat fish. So do you think from where, like regions from where you come from, that's going to change, and you're going to also move towards a more non-cruelty lifestyle?
Like as in plant-based diet? Okay. I think it's, for me, I've lived like in many places during my studies, and at different times I lived with vegan roommates, and so I ate a lot like that. But I think it's a very personal question, and it depends on your environment. And I think in the polar regions in Alaska, I'm definitely going to try to consume locally. Because one, it's because it's integral to my culture, and two, because it's a lower carbon footprint. And I come from a region which is called Bristol Bay, which is the last great wild salmon run on the earth. So if you want to look that up, it's the most intact ecosystem of estuaries and undamaged wild salmon runs. So I think that is very special. So I don't think I'm ever going to stop consuming my wild salmon, but I definitely try to make more informed decisions about how I eat based on where I'm living. But my friends call me a freegan because I'm just going to eat like what's in front of me because I don't want it to go to waste, and what's local. So that's kind of my mentality on that.
Yes, in the back, please.
My name's Jacob. I'm from America. The panel has been mentioning the importance of hopeful stories about the future, but I wanted to ask a question about a very dark narrative that has been spread by many at the World Economic Forum. I've seen many leaders say that one of the key causes of climate change is overpopulation because of the direct correlation between human activity and carbon emissions. Dr. Mahmood praised the work of Johan Rockström, who has worked closely with the Club of Rome. Overpopulation has been a key focus of the Club of Rome, and Klaus Schwab has said that he helped launch the first Club of Rome report. As well, Jane Goodall, who appeared on the screen earlier, said at a previous meeting in Davos that climate change wouldn't be a problem if the population was where it was 500 years ago. It seems to me that this is a dangerous and anti-human ideology, as it places the value of the environment as equal to or even above the value of human beings. So my questions for the panel are, 1, does the panel view overpopulation as a key cause of climate change? 2, if so, what are some solutions you support to deal with this? And 3, what do you believe would be an ideal human population size? Thank you.
That's a very difficult question. Overpopulation contributes to climate change, but it's not the sole cause of climate change. I mentioned about the Anthropocene earlier on, and I think this is what a lot of Johan Rockström's research has been on the Anthropocene, the human drivers, right? How we consume, how we pollute, how do industries develop, how do businesses do their business. So, tackling climate change is complex. It's not one solution. It's not, even if you reduce the number of people, if they're going to be polluters, they're going to consume in a way that is going to damage the planet further, it's not going to, reduce climate change. It will, but it won't eliminate it. It will just slow it down. So I think the solution and what is an ideal population? I mean, it really depends. As I mentioned about climate courage, one of the things young people are telling us is they don't want to have children because they feel that the world is such a terrible place to live in. They don't want to bring another child into the world. So these are the real things we're hearing from young people, right? And not just in Malaysia, but around the world. And this is the data points that we are getting. So I think population, how do you control population? What policies do you put in place? You look at Singapore and China that has, kind of one-child policy, and they're all reversing it because they're finding that, there are no people now left to be consumers or to work in their country. So this is it's a fine balance, and there's a lot of issues around ethics, around, faith, around all these things that are very, very personal. So we can't dictate whether someone's going to reproduce or not. But what we can do is provide the information for them to make the right choices for themselves and their families. So I think, dealing with climate change, the main thing, obviously, is we've got to keep the fossil fuels in the ground. And a lot of this is not happening at the right pace, and we need more stringent policies because that is it. It's the fossil fuels and the transportation.
So clearly the complexity is very high.
Yeah.
Unfortunately, we are running out of time. This has been a fascinating panel, and I think we've tackled health, nature, and the interaction between man, nature, and health and well-being from a macro level, but also from a micro level, the individual level, how our behavior can be changed, what we can do, how we can empower each other, the importance of education, the power of education, but of course also on policy levels, what can be done in an easy fashion, such as the example in Denmark, for instance. But there is so much more to do, and we really have a lot of hope in the younger generation, and also, of course, equally so the older generation, but through education, through the interaction, through getting the younger generation into also the policy making, we will be able to change, we will be able to create a better, more healthy environment and future for all of us. So thank you so much for joining us today. It's been wonderful to have you here. And thank you to all the panelists. It's been great to have you here. Thank you.